This statement by MMI is supported by PHM. PHM welcomes the launch of the WHO Diabetes Compact. Market oligopoly of a few pharmaceutical giants has kept insulin unaffordable for millions of people across the globe even 100 years after its discovery. Price control and regulation is important to increase access to insulin. WHO must promote transparency in R&D cost and in pricing practices of pharmaceutical companies for both originators and biosimilars. WHO must accelerate the pre-qualification program for biosimilar insulin to allow for entry of generic insulin manufacturers. PHM urges WHO to address the issue of patents on glucose monitoring devices and insulin delivery devices, which restricts access to insulin therapy. WHO must promote access to innovative technologies, including insulin pens, especially in humanitarian crisis settings. Government must regulate markups within the insulin supply chain. To ensure the last mile delivery of quality assured insulin to the most vulnerable populations, countries must strengthen cold chain storage requirements for the insulin supply chain and strengthen public health systems, particularly in LMICs. Insulin analogs must be made affordable by including them on the essential medicines list, and WHO must ensure that countries regularly update national EMLs as per the WHO model list of essential medicines. Countries must ensure appropriate regulatory oversight for the licensing and post marketing surveillance of similar biotherapeutics, and WHO should update SPP guidelines. To ensure availability and affordability of anti-glycemic medicines, countries must move away from partial price control, especially in LMICs, and also bring fixed dose combinations under price control. Finally, WHO must limit the influence of the food, alcohol, and pharma industry, as well as non state actors funded or supported by these industries, in advisory bodies responsible for creating policy and technical packages on diabetes prevention, control, and management.